Welcome back to chemistry session. Today's session, the learning objective is about toxicity of heavy metals. Bioinorganic chemistry, it plays a very important role in the living matters, origin of the living matters. At the same time, the chemistry, most of the chemical compounds involved in the process are the biomolecules. Most of the elements are useful for the biological system, but some of the elements are heavy metals are harmful for the human life, other living organisms. These elements are arsenic, mercury, lead, antimony. These are the heavy metals which are harmful for the human life or the living matter. Under these elements, heavy metals, you can go for arsenic. Arsenic compounds injure, arsenic compounds injure, destroy all cells and are known as protoplasmic poisons. Arsenic it reacts with sulfuride groups of the proteins and the simple molecules. Arsenic has popular homicidal poison because embalming fluids once contained arsenic, making its detection impossible and once the victim gets embalmed. The acute toxic doses of trivalent arsenic trivalent arsenic is about 100 milligrams. And the symptoms are being like gastric pain, developing into severe vomitings, diarrhea, and there are many severe skeletal muscle cramps. So the fluid loss can cause shock. When death may not occur until 24 hours after ingestion of the poison. The time course is affected by the dose and the presence of food in the stomach. Chronic poison is difficult to detect at the initial symptoms. Weakness, weakness, anorexia, occasional nausea, vomiting, diarrhea, constipation are some of the disorders. It is a gray, silver, white, silver, gray, or tin white. It is shiny, brittle, crystalline, and metal-looking element. The symptoms are melanosis, you can see the darkness of the skin, Brown's disease, facial edema, the swelling of the face. You can see hypopigmentation, spots on the skin. We can even observe skin cancers. And later, dimness of the vision for the eyes. Anorexia, nausea, vomiting, diarrhea, weight loss are generally observed for the here the stomach symptoms. And coming to the lungs, you can see chronic laryngitis, and you can even see bronchitis. There are some perforations for the nasal septum. See, you can observe the disorderness, the poisoning, almost most of the parts of the body. See, for the skin, we can see eye, stomach, lungs, liver, heart, teeth, and for the brain. There are different disorders for the different organs. Chronic arsenic poisoning is due to the industrial and drinking water. Workers in the factories produces food sprays, sheep dips, weed killers. When exposed to sodium or the potassium arsenate, and possibly to a very dangerous gas, arsine, ASH3. Some of the water supplies have been found to contain arsenic from their natural sources or industrial pollution. Patients ingesting arsenic chronically for 2 or 5 years may develop hyperpigmentation. And you can see raindrop appearance. For ingestion continuously for a period of 3 to 10 years, permanent keratosis you can observe. Keratosis later tend to undergo malignant change. And for the liver, if you see, hepatomegaly, jaundice, cirrhosis are the disorders that can be seen due to arsenic poisoning. And coming to the brain, encephalopathy, polyneuritis, tremor, difficulty in walking due to improper impairment of the brain. Next, for the heart, you can see hypertension, myocarditis. The treatment for this arsenic poisoning is supportive measures that have to be taken is gastric lavage, bleeding, intravenous fluids, cardiac monitoring, hemodialysis, exchange transfusion. These are the supportive measures. And for chelation therapy, British anti-leucite, 3 to 5 milligrams per kg for 4 hours. It should be given. This is the chemotherapy. The other one is the supportive measures, and the next one is the chelation therapy, giving chemicals. BAL, a very famous one, 3 to 5 milligrams per kg for 4 hours, for every 4 hours, until the urine arsenic excretion drops below 50 micrograms and for about 24 hours. And the usual therapy is for 1 week to 10 days. Penicillin, 100 milligrams per kg per day. And that should be given 6 hours for 5 days, 6 hours duration. And only if the patient is not allergic, they should be applied. So these are the poisonous effects of the arsenic. So generally, people who are working in the industries, you can see the arsenic poison and industrial and the drinking water sensor. Now let us see the poisoning of how it's affect the mercury poisoning. Of arsenic, even the mercury is poisonous. Environmental poisons, how it influences, that affects the body. Mercury is most common that you can think. It would be in thermometers, the only metal in the liquid state. Fluorescent light bulbs, batteries, and other household items also we are able to see nowadays. So there are many side effects with respect to this mercury. Inorganic mercury compounds are treated with syphilis and laxatives. Organic compounds which are used as preservatives, herbicides, diuretics, all these are the mercury compounds. Symptoms of the acute mercury poisoning are severe gastrointestinal irritation, metallic taste of the mouth, excessive salivation, you can see, inflammation of gums, marked renal impairment, Acute poisoning can be treated by eating egg smoke and suspension of the medicinal charcoal by gastric lavage. So for about 15 minutes it has to be done. Administration of dimethamphetamine, acetylpenicillin, chronic mercury poisoning, and increased you can see increased irritability, headache, easy fatiguability, colitis, stomatitis, increased salivation, dermatitis, liver damage, renal damage, and the antidote is dimethamphetamine. Antidote is dimethamphetamine. Toxicity of the mercury. Some adults can have inflammation of gums, known as gingivitis. Adults can experience stomach and severe exposure lead to the kidney failure in adults. Pregnant women, once the levels of exposure, the levels of exposure can affect the fetal brain development. And both adults and children, they may experience numbness, tingling, remorse, rashes can appear under various parts of the body. Both the adults and children can experience mental confusion. Both irritability, memory loss, shyness or withdrawal, tremors are common in the adults. These symptoms are common in the adults but have been prevalent in the exposed children. Children may experience swelling of the hands and fingers. Skin becomes pale. Children who are exposed may also have swelling, peeling on their feet and toes. And this mercury, you can see memory loss, allergies, mental confusion, irritability, high blood pressure, heart problems, and weight gain, digestive problems can be observed, the fatigueness, skin rashes, we can observe joint stiffness, immune dysfunction, cold feet, the balancing problem, like walking. So gastrointestinal problems are the cramps and inflammatory colon and diarrhea. Central venous system, weak pulse, increased blood pressure, chest pain, feeling of the pressure in the chest area, and respiratory problems can be administered. Those are the weakness, problems with breathing, emphysema, persistent cough. These are the problems that are experienced by the mercury toxicity. And there are some neurological problems like headaches, vertigo, tinnitus, and twitching of various areas of the body, eyelid, feet. You can see the twitching. So, the antidote for this is the dimercaprol. Even some food like proteins, eggs, and milk give suspension of the medical charcoal. Gastric lavage also helps for 15 minutes if you do. It helps to remove dimercaprol, a very common antidote. And chronic mercury poison can be characterized by irritability, headache, stomatitis, renal damage, liver damage, as we'll see. And now let us see the poisoning of the lead. In the lead poisoning, so treatment for the later we'll see, and toxicity of the lead. Soluble lead compounds are highly toxic in the animal and vegetable bodies. Lead poisoning is usually chronic in nature. Occupations involving the exposure to the lead industries such as ceramics, house painting, copper welding, printing, plumbing, storage batteries, manufacturers, all these are responsible for the lead poisoning. Like arsenic poisoning, even lead poisoning may be acute and chronic. So, the symptoms for the lead poisoning are vision, blindness of the parts of the visual field, hearing loss, and for the mouth, unusual taste, slurred speech, low line along the tongue, kidney failure, and neuromuscular tremors, pains, delayed reaction times, loss of coordination, convulsions, weakness, reproductive system. You can see sperm dysfunction in the males and come to the females' pregnancy complications. And for the central nervous system, insomnia, the loss of hunger, loss of appetite, decreased here, depression and irritability, cognitive defects, memory loss, headache, personality changes, anemia, abdomen pain, nausea, diarrhea, constipation, and wrist and foot drop, pain tingling, so fatigue, weight loss, so and the skin problems. These are all the effects for the lead poisoning. Yeah, these are all affecting the lead. The treatment for the acute poisoning is calcium phosphate salts, use of antipasmodics, and use of vasopressor agents, parenteral fluids, prompt gastric lavage, administration of the cathartics like magnesium sulfate, treatment of chronic lead poisoning. Symptoms of chronic lead poisoning is detected by persistent metallic taste in the mouth, anexoria, constipation, abdominal pain, lead, lead colic, muscle weakness, increased fatigability, leading to paralysis, headache, restlessness, tremors, lethargy, coma, lead encephalopathy, mild renal damage, calcium sodium acetate, dimercaprol are some of the compounds for the treatment. So for the acute and chronic poisoning, this is the way the treatment should be given. Yeah, this is the toxicity of the heavy metals that I've discussed. Arsenic poisoning, mercury poisoning, lead poisoning, and the treatment. Now, the next topic we are going to say it is the importance of iodine. See, iodine is very important in our daily life. See, for the main thyroxine gland, the main gland, it's so important. We'll see how the iodine is important. It is useful for the biochemical function Formation of the thyroid hormones. The thyroid hormones are the thyroxine T4, triiodothyronine T3. Total body contains 25 to 30 mg of iodine. Normal level in blood it is 5 to 10 milligrams per deciliter. 80% it is stored in the thyroid gland. The daily requirement is 150 to 200 micrograms per day. So the functioning of the thyroxine T4 and triiodothyronine T3 is because of the iodine. And role of iodine and what are its sources? Fetal and the body brain development, it is helpful. Hearing system development, normal prenatal body function. Animal products like meat and milk contains iodine. Water. And the factors which interfere the iodine metabolism, cassava, cabbage, thiocyanate, fluoride, and selenium deficiency. See how it's functioning, this iodine. The most important function of iodine in the body is in the synthesis of thyroids. The triiodothyronine T3, tetraiodothyronine T4, these influence large number of metabolic functions. A deficiency of iodine leads to decreased production of T3 and T4 and concomitant enlargement of the thyroid tissue. Iodine deficiency is leading cause of preventable intellectual disability. Iodine deficiency gives rise to hypothyroidism. Symptoms which are extreme fatigue, goiter, mental slowing, depression, weight gain, and low basal body temperatures. Next, iodine. It causes the rise of hypothyroidism and even the goiter. So this way it functions the most important functions. The thyroid hormones, T3, T4. And deficiency decrease the production of these two. So intellectual disability, a very important one. So the deficiency causes to this one. So iodine function, the component of iodine hormones T3 and T4. They regulate variety of processes, metabolic rate, heart rate, temperature, mental function. Signs and symptoms of the iodine deficiency are in the adults, children, hypothyroidism and goiter, thyroid gland hyperplasia. It is due to TSH levels increased. Congenital hypothyroidism. It is due to intellectual impairment, short stature, speech failure, and hearing loss. So this is the importance and the deficiency of the iodine. The biochemical function, its distribution, normal levels, and the role and the sources, the functions and the deficiency. Now, let us see the importance of the vitamins. You have different types of vitamins. How is their importance? What is their function? What is the daily intake? And what are the sources? First, vitamin B1. The function is breakdown of the glucose for energy. So vitamin B1 is called as thiamine. So due to this one, you get energy. There is breakdown of glucose and we use that energy. So the daily intake is 1.1 to 1.2 milligrams per day. The sources are pork, whole grains, seeds, nuts. Riboflavin B12, B2, all these are the B complex. In this riboflavin B2, it is useful in conversion of the carbohydrates, fats, proteins to ATP. And the daily requirement is 1.1 to 1.3 milligrams per day. Dairy, whole grains, dark green veggies, meat are the sources of vitamin B2 riboflavin. Coming to niacin B3, there is breakdown carbs for energy. As carbohydrates get breakdown for energy in presence of B. Almost B1, B2, B3 have the functioning of energy release. Niacin B3 and the intake is high, 14 to 16 milligrams per day. It's present in beef, chicken, fish, peanuts, whole grains. Pantothenic acid, B5. Even this vitamin has the same function of breakdown of the glucose to energy, and its requirement is 5 milligrams per day. It's present in meat, eggs, whole grains, legumes. These are the sources for the vitamin B5. And coming to pyridoxine B6, amino acids and protein metabolism is a main function of the pyridoxine vitamin B6. The daily intake is 1.3 to 1.7 milligrams per day. The sources for this vitamin B6 is meat, fish, whole grains, nuts, and seeds. Next, coming to the next B complex vitamin is B7, biotin. B1, B2, B3, B5, 6, 7, no B4. Okay. So the biotin B7, it is helpful for the metabolism of fatty acid, amino acid metabolism. The daily intake is 30 milligrams per day. And the sources are liver, egg yolk. And coming to the next vitamin, that is folate. Folate, it is vitamin B9. It is for the amino acid metabolism. It is for the amino acid metabolism. And also along with amino acid protein metabolism. The daily intake is 1.7 to 1. Sorry, the folate, it is 400 UG per day. The sources for this one is the leafy green seeds, leafy greens, that is green leafy vegetables, and egg yolk, seeds. All these are the rich sources of vitamin B9, amino acid metabolism, and that the rich sources for this one is the leafy greens, green leafy vegetables, seeds. Now, now coming to the next one, cyanocobalamin, vitamin B12. It is needed to produce ATP from fatty acids. It is needed to produce ATP from fatty acids. Almost all the vitamins B, they are useful for the metabolism, release of energy. 2.4 UG per day animal products are the sources for cobalamin. Next, coming to the vitamin C, ascorbic acid, synthesizes and maintains the collagen in the body. 75 to 90 milligrams per day is the requirement. Next, it is rich in fruits, citrus fruits, lemon, orange, amla. All these are the citrus fruits. Broccoli, strawberries, greens, and peppers. All this is the brief introduction of the vitamins. In detail, we can see the functioning and the requirement and the sources and deficiency. Coming to the next vitamin, vitamin A, vision, eye health, cell differentiation, immune function. So 700 to 900 UG per day is a requirement. Liver, fish, eggs, carrots, leafy, sweet potatoes, and cantaloupes are the rich sources of the vitamin A. Now, vitamin D, absorption of the calcium, phosphorus, bone health is the functioning of the vitamin D. Its daily requirement is 15 to 20 UG per day, milligrams per day. And the functions are egg yolk. Here, its rich sources are egg yolk, tuna, salmon, and liver. Next, vitamin E, its functioning is antioxidant for the cells. And its requirement is 15 mg per day. Its sources are the vegetable oils, leafy greens, seeds, and nuts. Vitamin K, synthesis of blood clotting proteins, fibrinogen, and bone health, cell growth. Its requirement is 90 to 150 mg per day. Vegetable oils, leafy greens are the sources of the vitamin K. And here, this is a brief description of the vitamins, functioning, daily intake, and the sources, and detailed functions and deficiency and how their metabolism will be discussed in next classes. So, today's class we have seen the toxicity of the heavy metals and importance of the iodine and a brief description about the vitamins. See here, vitamin A, its role is in the vision, function, and reproduction. Once if the deficiency is there, night blindness, corneal damage, damage to respiratory and gastrointestinal tracts. And all the vitamin B complexes, they are the coenzymes. Deficiency causes beriberi, angular stomatitis, dermatitis, depression, confusion, convulsion, diarrhea, hypertension, eyebrow rashes, muscle pain, fatigue, anemia, and acidosis. Coming to the vitamin C, antioxidant is a function, and scurvy is the deficiency disorder. And vitamin D, it regulates the calcium and phosphate metabolism. Once if it is deficient, rickets, skeletal deformities, impaired growth, osteoporosis, osteomalacia are the deficient syndromes. Next, vitamin E, it is the antioxidant. And deficiency, you can see sperm production inhibition, lysis and muscles and nerves. And for vitamin K, blood coagulation, subdermal hemorrhage. These are the deficiency syndromes. So we have seen the vitamins, their function, intake sources, and the deficiency symptoms. I hope everybody have understood today's class. It is about the toxicity, importance of the iodine, importance of the vitamins, and the deficiency. Thank you for today's session. Thank you for sparing your time in listening my class.